Hello, I am Dr. Pamni, working as a senior consultant in the Department of Obstetrics and Gynecology at Prathima Hospital, Kukatpalli. Menstrual disorders. It refers to a group of conditions that affect the regularity, duration, flow or discomfort associated with menstruation. What are the types of menstrual disorders? It could be amenorrhea. What is amenorrhea? It's an absence of menstruation. It could be primary amenorrhea or secondary amenorrhea. Primary amenorrhea means absence of attaining the first onset of menstruation before the age of 15 years in the absence of secondary sexual characters or before the age of 13 years in the presence of secondary sexual characters. Secondary menstruation. It refers to absence of menstruation for more than 3 or more months in a patient who was having a regular cyclical menstrual flow. Dysmenorrhea. It could be primary dysmenorrhea or secondary dysmenorrhea. Primary dysmenorrhea, it's a pain without any underlying medical condition. Secondary dysmenorrhea is a pain with the underlying medical conditions like fibroid, endometriosis or PID. Menorrhagia, it's the excessive or prolonged bleeding. Metrorrhagia, irregular bleeding. Bleeding between periods or at irregular intervals. Oligomenorrhea, infrequent periods if the patient has periods for more than 35 days cycle. Polymenorrhea, it's a frequent menstrual cycle. That means if the patient has a frequent flow of less than 21 days. Other thing is premenstrual syndrome. Physical and emotional symptoms that occur prior to the menstruation. What could be the causes of menstrual irregularities? It could be hormonal, structural, medical conditions or lifestyle changes or due to any medications the patient might be using. What are the hormonal imbalances? It could be in a condition like PCOS, thyroid disorders, hyperprolactinemia or perimenopausal or menopausal age group. Structural issues like any structural abnormalities in the uterus like uterine fibroids, adenomyosis, PID or any cervical or endometrial polyps. Medical conditions like obesity, diabetes, pelvic inflammatory diseases. Lifestyle changes could be a stress factor, can also cause menstrual irregularity or obesity or excessive weight gain or weight loss. Medications like contraceptions, anticoagulants. How do we diagnose and treat menstrual irregularities? Most of the diagnosis we can make out from the history and physical examination. So detailed history of the patient, clear pelvic abdominal examination is mandatory. Other tests which include diagnosing menstrual irregularities are the blood tests like a thyroid hormonal test and imaging like ultrasonography and MRI. And endometrial biopsy is in a very rare conditions. And how do we treat menstrual irregularities? The underlying cause we have to find out and we have to treat the underlying cause, only then we can treat a menstrual irregularity. Thank you.